All right, everyone, it's great to see you all. Thank you so much for coming to our provider meeting this month. We're excited to see you all. Happy that you're here. I am Kathy Borders. I am in provider relations here with Butler County. We also have Amy Winkler on the call. She will be manning our chat. She's also in provider relations with me. Feel free to put any questions or comments that you have throughout the meeting today in the chat box. We'll be manning that and doing our best to answer questions. If we're not able to answer them in the meeting, we will for sure get back to you. And also, if you have a comment or a question and you want to unmute and ask them, feel free to do that as well. We would love to have any discussion and questions during our meeting. That's what we're here for, is to help answer anything that you may have. So we'll go ahead and get started. Oh my God. Sorry about that, you guys. All right, I wanted to first start out by giving you a couple of updates from our Community Connections team. They wanted us to make you aware of a couple fun events coming up with Christmas and the holiday season coming up. There is a sensory-friendly movie on December 13th. There is the email, which I will email this flyer to you, so you'll be able to RSVP for that. And there's also a holiday dance, which I don't have a flyer for, but there will be details in the meeting minutes that will be emailed to you. Feel free to reach out with any questions to Jenny Mann about each of those. The dance, just FYI, is on December 14th at Redeemer Church in Hamilton. We will now turn the time over to Robin Thomas, who is here with us today from the Southwestern Council of Governments. She is going to be giving us a few updates on compliance.
Thank you, Kathy. I don't have a ton of information because there were very few changes to the compliance tools this time. I'm gonna go ahead and share my screen. There we go. Now we can see what I'm talking about. So very few changes, but I just wanted to go over them quickly, and I will send the PowerPoint to Kathy so she can share it to you guys. But these tool changes went into effect November 1st, so they've been in effect for a couple of weeks now. But again, nothing extremely earth-shattering. In the PowerPoint, on the left-hand side is the actual question, and on the right-hand side is the guidance. So I didn't think about putting that information, putting those specifics on my slideshow. It's been a very busy last few weeks, so I put this together kind of quickly. So I apologize for that. But the first one is regarding delegated nursing. A few changes in the actual question to take out the need for an annual staff skills checklist and add in that there is now a requirement for step-by-step written instructions and that the nurse observed and documented the satisfactory return demonstration of the nursing task. The guidance it is just clarifying regarding MedAdmin and 13 health-related activities in day service locations serving 17 or more individuals does require delegated nursing. And then it's also required for administration of glucagon, insulin by injection pump, inhalant, and injectable treatments for metabolic glycemic disorders, and then anything else defined in the nursing rule. So just cleaning that up a little bit. We also have, and all of these, there's only one that's specific for agencies, and I have that indicated. So all of these are the same for agency and independent providers. This one's regarding documentation indicating the type of service. This is a very minor change, changing that non-medical transportation requires mode of NMT provided instead of type. So that is either per trip or per mile. And then, does the waiver service delivery documentation for all billing codes include scope? So there was a change in, the description of scope, just to make it a little more clear. Because the way that it was written before, really didn't describe what we are looking for the scope of service. So mainly scope is that we want, the description of the service, that's related to the services that are in the plan. So, when you're putting information on a documentation sheet, we want the information that describes what it is that the plan says that you as a provider are doing. So, this is much more, readable and user-friendly than the definition that was, on for. This is regarding, employment services and the progress report that is, submitted every, 12 months. And it's talking about for vocab, group employment support, career planning, and individual employment support. And it's just clarifying it a little further, to make sure that it is submitted every 12 months, shows that the services are consistent with the person's outcome, and that they have either obtained, competitive integrated employment, or they're advancing on the path to competitive and integrated employment. It also talks about what the progress report will include. They changed it from shall to will. So here are the things that are required. They took out several things and then, kept the anticipated time frame and progress towards achieving the outcome, and then added, the individual's annual wage earnings, would be included in the actual progress report. Here's one that is specific to agencies, and it's regarding, training for DSPs. The only thing is a change in the guidance regarding empathy-based care, training. There is an initial, requirement. It is one of the topics required in initial training, but then there is a second required training arranged for or provided by the agency. So it's one of the initial topics in the, DoD required curriculum, but then there is, that within 30 days of hire, training provided or arranged by the provider, that topic needs to be, discussed and trained on again by the agency. So maybe something a little more in depth. And then the last question has to do with, provider owned or controlled settings. Does the individual have a lease or residency agreement? This has been, kind of understood, but not actually, written or specified anywhere. For shared living providers who are related to the person they're providing that service for, we as reviewers have never asked to see any type of lease or residency agreement, but now they have made it official by putting in the guidance that a lease or residency agreement is not required, for someone who is a related caregiver. It's been discussed and talked about for a long time. We've been told not to ask for those when we're doing reviews, but we are, we've got the the actual guidance now that it's not required. So that's finally out there. So we don't, we never really did. We would sometimes discuss it. But we don't ask for them, and now we have that official information. For non-related caregivers, it is definitely a requirement. But for those that are related, we don't have to look at those. I just have a quick word about the individual interview tool that we ask individuals questions about their satisfaction with services and things that are going on with them. That has had some significant changes done to it. And a lot of it has to do with the individual's choice and control regarding their living situation and their ability to access the community. So you may start to see more citations in that area because it is very significant. It's very broken down around individuals choosing roommates, having access to, food at any time they want, the ability to decorate their living space the way that they want to, very, very specific questions regarding their settings that they live in and accessing the community as frequently as they want to, and choosing the places that they go. That's pretty much, those are the types of questions we are asking individuals now, and not the do you have friends with and without disabilities? Are you participating in person-centered planning? It's really about what control do they have over their lives? What types of things are they choosing to do, and are they getting to do those things? So that's a very big shift in the types of questions that we are asking individuals. So anyone have any questions for me regarding those changes? I know those were kind of quick, but they were very few changes to actual questions themselves.
Hi, good morning.
Hello.
Hi, Miss Kathy. Just checking if you hear me. So I was a little bit late, so to getting in. I just missed the first part, though. Just letting you know.
Okay. I'm going to be sending the PowerPoint to Kathy to send out. So, but there were just a few changes, so nothing major.
All right. Thank you.
Okay. That's all I've got.
That's
Well,
it.
thank you, Robin.
You're welcome.
If any of you have questions and you didn't ask and they come up later, feel free to reach out to Amy or I, and we can get those over to Robin, or be able to get you those answers, or feel free anytime during the rest of the meeting to pop them in the chat. Always welcome to do that. All right, well, thanks so much, Robin, for being here. We will now turn the time over to Elizabeth Reisner, who is here from Butler County. She is in Employment Services, and she has some updates, information to share with us.
Hey, good morning, everybody. I'm glad to be here today. Thank you, Kathy, for having me. I see lots of familiar faces on the call. So what I'm going to talk about today is everybody's favorite topic, the state outcome tracking system. It is that time of year again. So let me share my screen, and I have some helpful hints that's going to make it painless and hopefully make your life a little bit easier. Okay, and can everyone see my screen?
We cannot.
Second.
Oh, there, yep.
There we go. Okay, so what is the outcome tracking system? Let's go ahead and start with that. The outcome tracking system is an application used to explain how people live, work, and play in their community. And why is this so important? Well, it's important because it's going to determine funding and align policies and procedures and legislation that is going to help improve the lives of the people we serve. So training and support, you're definitely going to need that if you're new to this system. So what you'll want to do is go to the Ohio Employment First /resources, and there you will find videos and trainings. I actually just watched one yesterday myself, where they walk you through the process of how to use the system, how to navigate the system, and how to really feel confident. You can contact Ann Tapia. She is our Community Life Engagement Project Manager for the Southwest region, or I would love to come out and work with you guys one-on-one, so you can call me anytime. And just know that the trainings are going to be offered weekly moving forward. So I think that's helpful to know that you can get some one-on-one support either through us here at the local level or at the state level. You have to be able to log in. And I know that in the past, this has been somewhat of a challenge for providers. You have to have an established account with OHID. And if you're requesting the access as a CEO, then all you simply need to do is go into your support homepage, select update my account access, and then select OTS. I also have accompanied with this guide a step-by-step process. And if you want to call IT, if you're not, too tech savvy, that's okay. You can call this 1-800 number that I have listed here, and you're going to select option 4. So the reporting period, the OTS system looks at a snapshot of time. So they picked the month of September to look at. So the reporting period opens October the 1st, and then you've got 6 whole months until March the 31st to go ahead and enter your data. As of this year, only the adult day providers who have been selected for the ADS quality pilot have been selected to do this. If you were not selected for the pilot, then it's optional, but we strongly encourage you to do it. And then, of course, all employment services providers are obligated to do it each year. So how is the data pooled? How do I get these people assigned to my queue? If I have billed one of the following services within the past 12 months, ADS, vocational rehabilitation, group employment, or individual employment supports, or career planning, then that person will automatically be populated into the appropriate provider's queue. It's very simple. It only takes about, I would say, 3 to 4 minutes to complete the 7 questions. So the questions are as followed. Is the person participating in the ADS quality pilot? You'll mark yes or no. Is the individual in a competitive job? And that is work that occurs on a full or part-time basis. Must make at least minimum wage, 1010 or higher, and it must occur at a location that is considered integrated. Are you supporting this individual in a community or in a group integrated job? To answer yes to this question, the individual works as a team, generally at a single worksite host, community business that has ongoing support provided. So specific examples include enclaves, mobile work, or a provider-owned business. Is the individual in facility-based work? To answer yes to this question, this includes all employment services that occur in a setting where the majority of employees have a disability. So these specific examples include sheltered workshops, work activity centers, and extended employment programs. Is the person self-employed? And this can be with or without supports. Are you providing the individual facility-based non-work services? To answer yes, this includes all the services that are in a setting where most of the participants have a disability. These services do not include paid employment of the participant. Are you providing the individual community-based non-work services? To answer yes to this question, this includes all services that are focused on supporting people with disabilities to access their community, activities and settings where most people do not have disabilities, and it doesn't include paid employment. So the first time that you're filling these questionnaires out, I wanted to give you a little sample of what that would look like. So you're going to answer all 7 main questions. Anytime a yes is answered, you're going to have sub questions that populate. The system will not allow you to move forward with sub question or without all sub questions being answered. So if you need to come back, for example, on my caseload, I have a lot that I need to verify the current hourly pay rate. Then I save those and I come back once I have the information. So it's not that you are obligated to fill it all out in one sitting. So once you hit that final submit button, you are not able to go back and edit it. So that's why it's really important that you make sure you have all your needed information up front. So here is a sample of the questions, just to give you an idea of what it would look like. If a yes is marked on question 2, the competitive employment question, then a sub question follows, and it's going to ask the name of the employer, the wages, the number of weekly hours worked, how do they get to work, what is their transportation source, and do they receive any fringe benefits such as employee discounts, medical benefits, any other type of fringe benefit. So here's a live example that I gave you. This person is employed at the Woodlands of Middletown. They earn $10.10 per hour and they work 20 hours a week. They have an agency that provides their transportation. They do not receive any fringe benefits, and their occupation type is food preparation and service related. Now, they have gotten a little wise in the occupation column and they have an other. So if nothing that's pre-populated pertains to your person, you can mark other and put what it is. So once all the questions are answered, you can then hit submit and you'll move on to the next questionnaire. Now, this was already talked about by Robin, but I do want to reiterate it. So path changes for the provider tool. For individuals on place 1 or 2 to the path to employment, that has not changed. You have to have your outcome, your employment outcome, and your action steps for anyone who either has a job or wants to get a job. For path 3, this is a bit of a change. The ISP is going to have to describe the activities that will occur that will advance the person on their path to employment. And perhaps the biggest change of all is those on path 4. So you have to, the SSA and the team has to prove that within the most recent 12 months, career options, employment opportunities, and most importantly, the economic impact of the individual's decision not to work needs to be addressed. And you need to show that their outcome that they're engaging in meaningful activities and really shows what their successes and capabilities are. If the individual receives employment services and the progress report demonstrates no progress, then that ISP plan has to be amended to identify the barriers and most importantly, the action steps to overcome those barriers. And last but not least, the employment progress report. So again, Robin talked about this, but I just want to make sure that we have a good handle on the components. So providers of employment services, and this includes vocational habilitation, group employment, career planning, and individual employment supports, they must have a written progress report every 12 months that shows that the employment services are consistent with the individual's competitive integrated employment outcome, and the individual has either obtained competitive employment or is advancing to competitive integrated employment. And we have mapped out for you all 6 elements. And Kathy did a wonderful job and created a template that we're going to share with you after the meeting. But you must have an anticipated time frame of progress towards the desired outcome. You must have the annual wage earnings, and I would add that it's helpful to have the hourly rate as well. You need to list out the barriers to employment, and if there is no advancement, then how are we going to overcome those barriers? The SSA is required to revise the outcome if there are barriers that haven't been addressed. The desired employment outcome and the place on the path to employment. And again, there's no required template, but we've got a nice guide that we hope that you'll utilize. Competitive integrated employment, I just want to review that definition one last time, just so that there's no confusion. So that it is work on a full or part-time basis or self-employment, compensated at minimum wage, that 1010 or higher, eligible for similar benefits as other employees with a similar position, and a work location that is integrated where the person interacts with people without disabilities to the same extent as those with a waiver. And then a person is considered competitively employed if they receive individual employment supports, as long as all the above factors are mentioned. Did anyone, I know that was a whole lot of information to digest, and we don't expect you to know it all, but we do expect you to reference the guide and just reach out to us when you have questions. And if anybody has any questions, I can take those now.
Yeah, hi, good morning.
Good morning.
Yes, good morning. I am a new provider. My name is Ndaylo. So I am interested for the 101 because I think that's helpful for me. So
Wonderful. Yes, I'd be happy to meet with you one-on-one. If you want to type your information in the chat, I can get in contact with you after the meeting.
okay, all right, I will. Thank you.
All right. My pleasure.
I have a question for this one. If we provide the HPC in-home care, we don't need this tracking system, right?
That is correct. It does not apply to HPC.
Thank you.
But that is an important question to ask.
Any other questions? Well, thank you, Beth. Thank you for sharing that information with us. It's a lot of great information for those providers that are providing employment services. So we appreciate you being here to help us with that. And we will be sending out all of the guides that you provided in our meeting minutes. So there'll be a lot of great resources there. Again, we'll be able to reach out though. Please reach out if you have questions or need help. All right, I am going to, oh, does someone have a comment? All right, well, I have a lot of great updates for you from the DODD side of things. There's been a lot of announcements, a lot of releases from the department since we last met. So a lot of great things. You're going to want to be sure to look at the minutes to have access to all of this information. There are links built in to the minutes that you'll want to be able to go to get all this information after our meeting. So the first one is just, we announced it last time, but the rates were for all services, almost all services, were historically bumped a significant amount, 38%. By July, it'll be at 38%. So that's huge. We're so excited about that. The initial bump will take place on January 1, and then a second bump happens on July 1. So you're gonna want to be able to access those new rates. We have created for our county a one-page summary of the rate changes for the most common services for both agency and independent providers. So we will be sending those out. We can also send those to you if you need them at a future date. Just reach out to us. But those will be unique to our county, which is the cost of doing business category 7. So Hamilton County is a category 8. So you would want to make sure you have the right rates for each county. There is a link into our minutes, though, to go and look at those rates. If there's any services that you're providing that we did not include it in our rate charts, you'll be able to link there to get those. They have a summary of all those changes there on the DODD website. Any questions about this before I move on? All right, great. Another exciting thing that occurred from DODD this month is they have released some new documentation templates so that providers have a more universal template to be using that has all of the requirements from Rule. We have adapted them just a little bit to fit our county to make them a little more user-friendly. So we will be sending those out today. Some of the most common ones. If there are services that you're providing that we don't include, feel free to reach out to us. They're also in our Butler County Provider Portal. If you are using our portal, if not, we encourage you to do that. Reach out to us if you need help logging into that, but they will be able to, you'll be able to get to those anytime. They are, the good thing about them is that they flow nicely with the new Ohio ISP, which in Butler County, most of our individuals are being now in that format. So these new templates will be very helpful in following along with and documenting for that new plan. Any questions here?
I have one question. I look at the Ohio, the HPC home care documentation templates for outcome. I understand the outcome is experience number. I just have a question about at the bottom, they have a date, outcome / experience number, and then say what happened, what was learned, what worked well, what didn't work well initially. So all that one, it's optional or it's required each day they have put some comments. Before, normally we just using the code or initiate, right, for that one. So I just try to ask a question about that part.
Yeah, great question. So the new templates now have a couple of different pages for the outcomes. So the first pages are for you to list the actual outcome and the action steps and a little bit of detail about those action steps. And then there is a new page added at the end of that if you want to provide additional documentation about what's occurring. Sometimes your SSA will ask for that additional detail. It helps in the time of plan revision to be able to look at what progress has been made, how those outcomes can be adjusted, how they can be changed. Because outcomes don't stay the same every single year. We want to update those so that information can be helpful. It would be considered optional, documenting that extra information, just because we don't know what you might have to include there. There may not be anything significant other than because the action steps are very detailed. So there may be enough captured in there, but it's just an additional resource for you to have if you need it, when you need it.
Yes, thank you so much. Really appreciate it. I just want to make sure because my provider asked me how they feel. I think it's optional when they feel big progress, something they want to talk the market. I just want to make sure. Thank you so much.
Yeah, it's just very helpful in capturing the whole year. It's hard at that time of the planning meeting to come back and remember all that's happened throughout the year. So that's a great place to kind of stick some notes so that you have information to bring to that meeting to make changes if needed. It is that is one big change about the templates is they were much shorter, and so they are, I think, like 5 or 6 pages now. There's just a lot more places for you to be able to add information as things happen. Any other questions about that? All right, another update or another great resource that DoDD has provided. There are instructional guides now available on this website, link right here, for PNM. So that's the system where you are making, changing your DOO, adding services to your certification, updating your address, recertifying, any of the things that you would need to do to your DoDD certification lives in PNM. And so there are guides to now help you through that. And they're really great because they include screenshots. So they're very helpful. I encourage you to go there and check that out. Store those. I've already downloaded them, saved them for myself. They're a great resource. The next kind of update I wanted to share with you today is we are nearing the end of the year when the Appendix K flexibilities, that unwinding period is ending officially December 31st. There are some documents and videos that have been released by DoDD that summarize the major changes that will be occurring due to that unwinding ending. There are one-page documents, and then there are also videos that they have just released. So again, the links are there. The big change, just summarizing kind of the biggest things that apply here, is the change to residential respite. That now is a service that will be able to be billed starting January 1 by independent providers. It used to be just for agency providers, but the additional billing unit of 15 minutes has been added to that service. And that's for people that are receiving shared living services. So there will be this option to do that. So if you have currently been providing HPC to someone that has shared living, that will no longer be allowed due to that unwinding ending. So in the future, that could be billed as residential respite along with that shared living. It gives an option for the shared living providers to have that support if needed through residential respite. So if you've been providing that, you're going to automatically have residential respite added to your certification. That will show up on your certification on January 5th. If you have not been providing that service and it's something that you want to add, you will have to add that service through an add-on service application through PNM, which we talked about just previously. There will not be a fee normally to add a service to your account. There is a fee for that. That will be waived. They advise us, the sentence here that's underlined, that you would want to put a note in your application letting them know that you are asking for that fee to be waived. At the bottom of the screen, when you're in the application, on the bottom left, there's a button that says communicate, and it has a little green window with it. You click on that to add in your notes there. Feel free to reach out to us here at Provider Relations if you have questions or run into difficulty doing that. But for anyone that has already been providing this service, you really don't need to do anything. It will automatically be added. Any questions about that?
Yeah, I have a question.
Yes.
Can somebody do residential respite and shared living in the same day?
So that is the change of starting January 1. Yes, but only at the 15-minute unit and not the daily unit, because there still will be a residential respite service at a daily unit. But the 15-minute unit service could be billed on the same day. There are limits to it, the number of hours per day, and then also per month are built into that rule, which I can get to you if you would like that. But as long as you're in those limits.
Thank you.
And this is something that you will work with the SSA to have it authorized. If that's something that the shared living provider is in need of, you'll be working with the team to get that set up. Any other questions before we move on?
Yeah, I also have a question. For Pendat K, during the emergency COVID period, we using a lot is the parents take care of their own kids under 18. So they said it's under Pendat K. We have this case, and now I want to know they will stop December. So, but it's still not easy to find the provider right now. So the parents can allow or they have to stop service.
So we are still waiting for additional guidance on that. We do not have all the final direction on that yet. So we will want to get with you once we have that. The SSA department will hopefully be communicating that out as soon as we get it. So I'll make a note to follow up with you when I receive that, when we receive that.
Thank you.
Another great resource is, if you're not already, those Memo Mondays. DODD releases any big information updates, rule changes, a lot of the things we're talking about here in those Memo Mondays. I encourage you to subscribe to those. You do that through the DODD website. There is a link at the bottom for you to subscribe, and it gives an option of different information sources you would like to subscribe to, and you would want to choose the Memo Monday one. All right, so I'll move on here. Great questions. Thank you so much. So the next few are kind of some repeats from before. Just wanted to give the dates of trainings or support sessions coming up from DODD. We have the provider resource and support team. They're doing monthly information sessions. We have the 2 topics coming up for November, December listed here. Some really great ones. Encourage you to jump on those. The link is here to be able to do that. The other one is a open door office hours that they are offering. The DSP and provider support team offers that. It is the second Wednesday of each month from 9 to 10. You do not need to register. You'll just join the link here, and also you can access it here on the DODD website. And those topics, they're really kind of open-ended for you to come with questions and network together for those sessions. Just a reminder about that. My last little bit here is about training opportunities. I want to remind you that Butler County, we have an MUI UI training session coming up next month. Would love to have you join us. We're going to be talking about incident reports, going over in detail how to fill those out correctly. You can receive 1 hour of annual training by attending. So we'd love to have you. The registration link is here and our Zoom link to join us there. The SWOCOG is offering one last training this year, a social skills training on November 29th. Sounds like a great one. You can register at the link here listed. We'll send this out with our meeting minutes for you to be able to register for that. And if you have any questions, Robin Thomas would be your contact person for that. There is a resilience-based de-escalation training being offered in each county throughout the next, I think it's 6 months or so. So each county kind of has a turn at that. So our turn will be in April here in Butler, but I also listed links to register for any of our neighboring counties in case you would like to attend sooner, but we'd love to see you in April at ours. There's more information in our minutes about that training and what will be covered. So it sounds like a great one though. Training tomorrow is a lessons in accessibility that's provided by OOD. The link here will be sent out. DODD has monthly virtual provider trainings on the last Thursday of the month. The next one looks like they're taking a little break. The next one for the holidays is January 25th. This will be really a great one in provider compliance reviews, specials, and abbreviated reviews. So a lot of great information, compliance related. And it looks like you can receive an hour of annual training for that as well. The last few trainings listed here are just some new DoDD My Learning trainings. They are doing a great job of adding new ones all the time to the My Learning portal. So just wanted to list those here so you're aware, and they have links directly to them. And these can count towards your annual training hours. So those are a great resource for you. So since this is our last meeting of 2023, I wanted to give you our dates coming up, all of them for 2024. We're going to continue at this 10 o'clock time, also on Zoom. It's been working really well, so we are excited to continue that. And here's the dates if you want to put those on your calendar. We'd love to see you. Before we end today, I just want to ask if there's any other questions or comments before we end.
I have a question.
Yeah, go ahead.
So, Miss Kathy, I am a new provider, and I see that to have a client for me is very hard. I don't know, it's for everybody. I keep on putting application, but I don't get any return. So that's my question for today. How we get the client?
Yeah, that is hard. Getting started is a little takes a little bit of time. Patience. I don't know if any of our providers have any words of advice for Miss Lowe here, but just continue applying. Reach out to other counties, perhaps neighboring counties. You're doing all you can. You're doing a great job. I know, accessing our portal. Again, a little plug for our portal. Our provider portal is where all of our requests for services are posted. So if you're looking for clients, that's where you would go. So if you're not using that portal and need help getting in, please reach out to us. We can get you accessing that.
Okay. Also for my fellow or her provider, if they have any help or suggestion to give me and stuff, I really do need it.
Yeah. Well, I'll reach out to you and we'll talk more.
Okay. Okay. Thank you.
We may not have as many independent providers on our call today, and we have a lot of agencies here. So we'll get you some support. We'll get you some help. We're glad that you're here.
All right.
I'm sorry, I couldn't understand what she was saying.
Oh, Sabrina, she's just having a hard time finding clients. So she was just looking for any words of advice to get clients.
Oh, okay. Well, I only take care of Katie, so I'm not very good with helping on that part. I'm sorry.
Yeah, no
That's
problem.
okay.
Glad you're here. All right, we'll go ahead and end our meeting. I think all of our, I mean, we don't have any other questions in the chat or anything.
Nope. Yeah, I think we're good.
All right. Well, it's great to see you all. We will see you in a couple of months, January 17th. It'll be here before we know it, but have a good couple months and we'll see you soon.
Bye, everyone.
All right. Take care.